Improvement of any system requires will, ideas and execution. Improvement work often means that we work with people willing to improve, start with ideas we think are going to work, and execute in a series of tests towards a goal. This often means we start to change our ideas based on the feedback from the tests we run. So any evaluation approach we use to understand what is working and where will also need to adapt alongside the improvement work. It's not helpful to wait to the end and pass judgment on whether something has worked or not. To do this, here at IHI, we've been applying rapid cycle evaluation, an approach to evaluation that suggests we periodically pause, reflect and amend our improvement approaches. At the heart of a rapid cycle evaluation approach are 5 core components. 1. An aim. What are we trying to achieve? 2. The what. What are the changes we're trying to make? 3. The how. How will we make these changes? 4. The measures. How will we know that a change is an improvement? And 5. The dissemination plan. What do we plan to share and spread within an organisation or outside an organisation? These 5 core components align with our improvement approaches, and in the IHI offices, we are reminded of these on a daily basis. Let's go and have a look. So, how good by when? Well, this reminds us of our first core component. It's about setting a measurable goals or aims for the project, and also being clear about what the timescales for achieving those goals are. The knowing is not enough. We must apply. This reminds us of our second core component, the what. It reminds us to think about what is it specifically, what are the changes which we predict, which people make at the point of care. Not only do we need to know them, we need to apply what these changes are to practice at the point of care too. The hope is not a plan. This reminds us of our third core component, the how. It suggests that it's one thing to provide people with a description of the changes we'd like to see, but we also need a wider plan to help people test those changes. So I'm standing outside the Schuhart room, and this reminds us of our fourth core component, measurement. Walter Schuhart was responsible for developing the control chart methodology, which we use now to help us understand whether changes we make lead to improvement. So all teach, all learn. This brings us to our fifth core component, dissemination. This reminds us that we need to be able to communicate, spread and share what it is that we've learned from our improvement work so that others can apply it in their own settings. So we're starting to apply these 5 core components within IHI. We'd love to hear from you whether these core components resonate with your improvement work.